what are some things you experience with patients that you see as far as buy-in, like getting them to buy into the program that you are going to have for them or the treatment you're going to have for them?
Yeah. So buy-in is the big main factor in compliance with physical therapy. As a society, we are consumers. We want a product.
Mm-hmm.
Traditional medicine, you go to the doctor and you're in pain, you're sick, whatever. You want a pill or a surgery.
You want a quick fix.
Exactly.
Mm-hmm.
And that's not at all what physical therapy is.
Yes.
And so it's work. And so if you don't have the patient's buy-in on, okay, it's work, I'm going to dedicate all this time and effort and I'm going to do this stuff that this person is telling me will help me. If they don't believe in you, they're not going to do it and they're not going to make changes. And then physical therapy won't be an effective option for them. And that comes down to the therapist. Patient education is huge. You need to be able to explain what you're doing and why you're doing it.
Yes.
And try to give them explanations as to why they're in pain. Because a lot of times when someone's in pain, you know, your general population doesn't have an understanding of how the human body works.
Right.
So if they're in pain, they think something's wrong.
Yeah.
Or they're injured or whatever. But that's sometimes not the case. It's just like a tissue tolerance issue. They've overdone something. So being able to explain all of that to them effectively. So it doesn't matter if I use big words. If they don't understand it, it's not going to be effective for them.
Yeah. They don't care how smart you are. They care if you can fix the issue they're having.
Exactly. So education, explanations, examples, demonstrations, all of that is going to be what is utilized to get that buy-in. And once you get that buy-in with someone, you can have them do whatever. But it's establishing that. And that's comes, you know, I'm going to say at the eval, but it's even before that. It's effective marketing. It's the physical therapist as a profession, our education into society. Chiropractors are great. They have great buy-in because you know a chiropractor. Everyone has their own chiropractor.
Right.
As a profession and in a broad statement as a profession, and then personally, I want to be someone's physical therapist. I don't want them to have to constantly be coming to me, but I want them to know that if something comes up, I'm just going to call Michaela.
Yeah, that you're available to them. And definitely, and this is even true in personal training as well, but establishing trust with patient is huge for sure. Do you feel like with, for example, like a chiropractor, that there is a little bit of what you were kind of touching on with there's a little bit of instant gratification because, you know, they do something or, you know, crack the back or whatever. And there's some of that there as well.
Absolutely. And as a therapist, I should be doing that too. Because I want the long-term changes, but someone's not coming to me day one for a change in 6 weeks.
Yeah.
They want to feel better right then. So there's some things we can use. There's modalities, mobilizations, joint mobilizations, that kind of stuff to help them get some relief soon. And then that education component being like, yes, we're taking your pain from a 9 to a 7 right now, but in 3 weeks, I promise it'll be at a 4.
Be lower.
If we could just keep going.
Yeah, for sure. What else with consumer society? Anything else that you want to touch on with that?
No, I think that's the biggest thing. A huge hurdle.
Yeah,
I'm
it's
sure
a hurdle.
with personal training, everyone
for sure.
wants immediate changes. And
for sure, it's the exact same concept. I mean, I feel like physical therapy, personal training, we're always fighting with that instant gratification culture. You know, it's just not a thing in this area.
No.
You know?
Not at all. Your body doesn't really care what you want.
Exactly.
It responds how it responds.
Yes. It responds to the stimulus you put on it, for sure. Can you touch on a little bit the difference between like a traditional physical therapy medical model versus like what we do here at Build Power Grind?
Yeah. So Traditionally, you're going to go to your outpatient clinic and they're going to utilize your insurance. So your treatment frequency may vary. You may see them multiple times a week. You may see them for long durations. You're just probably going to be paying a copay, which is just a portion of the fee, versus our model, which is one-on-one and it's cash-based. So that is a hurdle. You have to have someone who wants to be able to move and has the money, the funds available to spend on that versus just using their insurance. Now, I'm going to argue that there's so much more benefit for our model.
For sure.
But with that, I'm only typically going to see someone one time a week. And so then they're going to be utilizing their time outside of our sessions to do the bulk of their home exercises and their bulk of the strengthening and the movements. When they come and see me, we're going to use that time mostly for our modalities, dry needling, cupping, that kind of stuff, manual therapy.
The things they can't do at home.
Exactly, the things that they need me for. And then from there, obviously we are going to come out into the gym and do some movements. But with that, it's mostly me teaching them the movements, making sure their form is appropriate, and that we're actually targeting and doing what we're supposed to be doing. And then from there, they're going to go home and do the work.
Yeah, and you provide them resources though at home.
Yeah, absolutely.
Like videos and
yeah. So we use True Coach. I think that's what you use for personal training as well. So each day, usually with their home exercises, it's 3 to 4 times a week. We typically follow the strength training guidelines there because you're having to make a change. So it's going to take multiple efforts a week. And so I utilize True Coach. All of their exercises are programmed there. There's videos, and then I provide their dosage, any comments, any reminders. It's all on there.
All in there, yeah. So they really have a lot of access to you, truly.
Yeah, and you can leave comments on each exercise. You can send me a message, and then I tell everyone you can always just shoot me a text, or I'm always around here. You can just stop me and ask.
Yeah. So kind of going off of that, do you want to touch on the effectiveness of like the traditional model versus what we do here at Build Power Grind?
Yeah, physical therapy in general is very effective if it's done appropriately. Your traditional model, I'm not going to discredit their effectiveness in the slightest, but you are typically being seen by multiple different providers. You're probably going to be seen at the same time as someone else is being seen. So I love our model in that you're one-on-one with me. My eyes are on you the whole time.
The hour is yours.
Exactly. You can ask me questions. You can pick my brain. You can do whatever. So I think our effectiveness with that is superior. I will say, though, I am seeing them less often. So it's on them.
Right.
I'm giving you the tools, and I'm hoping that you understand what I'm saying. And if you don't and you're not getting that buy-in, that's on me.
Yeah.
I'm never going to say, oh, the patient's not doing their therapy exercises, so they're not improving. That just means I've not done my job effectively to get them to understand the importance of it.
Right. Maybe just needs a little bit more education or, something to that effect, if that's occurring.
And another thing, time is a huge thing, a huge resource that people either have or they don't have. So for me, if I'm providing a home exercise program that's taking you an hour and a half to complete, that's not effective.
Yeah.
So I need to be evaluating what I'm prescribing, looking at it, and seeing, is there maybe one exercise that targets all of this that's going to be more effective for you?
Yeah. And that's another component of that really individual one-on-one piece that you're able to provide.
Yeah, exactly.
And you like you were saying, are able to be really efficient with your exercises. Like if a client or a patient doesn't have a whole lot of time, then you can pick one exercise that's really targeted and then have a good progression in that way.
Yeah, progressions are huge. If I haven't provided you an appropriate progression, then you're not going to make improvements. So then if you're not making improvements, you're not going to be compliant with your program because I'm not helping you. So progressions don't have to be fancy. I mean, most exercises don't have to be fancy. The basics are great.
Yeah.
A lot of our clients, my clients that I have, either have some equipment. That's one of the first questions that I ask. What equipment do you have at home or do you have available to you? And I go from there. That's where I want to start. And I develop our progressions based on that. A lot of my clients are also gym members. So I'm always educating them on, you can always do our exercises as your warm up, as you guys are having them go through the warm up, maybe just take a couple minutes and pop back to the back and do a few of our things to get you set up for class. There's always different strategies that we can utilize to be able to get that program in, that home exercise program in.
Yeah. And also knowing how long the progression should be and, knowing when they are ready to kind of go on their own. And is there anything you want to touch on that?
Yeah. So your progressions, you should never be doing the same exercise from the beginning to the end. It can be the same type of exercise. You can start with a glute bridge, but then it should go into like a segmental glute bridge, and then it should have a band, and then maybe it has an eccentric component. Maybe there's a heel elevator. I mean, there's all these different things that we can do. That doesn't have to be fancy, but we need to be progressing.
It needs to be effective, like
exactly.
You said.